This portion is brought to you by Mercury Drug, nakasisiguro gamot ay laging bago.
Today in Generation RX Plus. Asthma and sports. Can these two go hand in hand together? Find out in our Ask the Experts. These two guys may not have asthma, but they're really good in bowling, in Secrets of Your Sport Hero. This is one sport that may be good for your lungs and certainly good for you. It's wushu in The Good Sport. Speaking of asthma, meet the boy wonder who overcame his ailment through ice skating, Michael Martinez, in our sports trivia. It's the biking gadget cyclists can't do without. Know more about it in Executive Toys. It's still summer, so learn more how to maintain that healthy skin from Dr. Salinel. All these and more on Generation RX Plus.
Good morning, this is your host, Dr. Cecil Katapang. Can asthmatics really do sports? Well, it's an understatement because we all know an asthmatic person who are very good sportsmen. Welcome, and you are watching Generation RX Plus.
So, asthma is a chronic inflammation ng airways. So, ibig sabihin, nagkakaroon ng irritation, okay, or bronchoconstriction. So, bronchoconstriction, ibig sabihin, lumiliit yung mga daanan natin ng hangin sa baga. Yung environmental triggers naman, ang kasama doon, kung may infection, respiratory infection, kung may mga pollution, no, yung usok sa labas, kaya yung may mga strong perfumes, minsan nakaka-irritate din yun sa mga asthmatic patients. Any form of physical activity kasi can also trigger asthmatic patients. Sports is a form of exercise, okay? So, nangyayari kasi with sports, kapag nag-sports tayo, yung na-inhale natin is yung dry or cold air, okay? Yung cold air na yun na nag-trigger doon sa airways, okay? Yun yung nakaka-irita doon sa airways ng mga asthmatic patients. That's why nahihirapan silang huminga during exercise. Actually, any form of sports naman is pwede naman with asthmatic patients. Ang importante lang kasi, you have the maintenance medications for your asthma or well-controlled dapat yung asthma mo for you to get into a sport. And of course, by the advice of your doctor. Yung medications natin for exercise-induced asthma is also the same as the usual asthmatic person. So, meron tayong mga tinatawag na controller medications and also yung mga reliever medications. So, yung reliever medications, yung mga short-acting na bronchodilator na ang very familiar sa atin, yung salbutamol, no, inhaler, or yung pampausok din na salbutamol. Yung mga controller medications naman natin, ang isa sa example nun, yung mga ICS-LABA combination na tinatawag natin, which is also very available naman din sa market, like yung mga gamot natin such as Seritide, o yung iba mga Symbicort and others. Sa mga pasyente natin na mahilig sa sports, no, siguro you should know or you should at least know kung ano yung sports na less na pwedeng mag-cause ng exacerbation ng inyong asthma. It does not necessarily mean na asthmatic ka, hindi ka pwede maglaro ng sport. Okay? So, very important are your maintenance medications or your controller medications which you have to use regularly, or yung mga reliever medications which you have to use naman as necessary. And of course, you should have a regular follow-up with your pulmonary doctors. For those asthmatic patients who are not into sports, still the same. Proper maintenance medications then.
Just like our champion ice skater, Michael Martinez, don't let asthma stop you from being the best in your chosen sport. Please do follow us on Twitter at GenRX+. Thank you to HP Pearl Sports Center. We'll see you all again next week. Always remember to live well so you can play well.